Good day, I am Marisa Karapatan, and today we will be doing a checklist for intravenous fluid. And first, we have to assess the patient, first with the doctor's order, and then we have to check the type of the solution that will be given to the patient. So, next is the rate of infusion that we are going to do for the patient, then the route of administration, and we will see to it that all the documents and the files that the patient has should have a physician's signature, because this is the most reliable source for documentation, and that we could see that the information is all correct, and the medication is appropriate for the client. The next thing that we are going to do is to make an IV label which has the doctor's signature and the nurse signature with it. And then the IV solution that should be given, and patient's need for medication. Then we have to assess the compatibility of medication with existing IV solution, because if it is incompatible, there will be a crystallization within the tubing, and it means it could give harm to the patient. We will also assess for the patency of the patient's existing IV infusion line. Therefore, it should not be blocked, and it is for the medication to reach its effectivity in a venous calculation. So we have also to assess the IV insertion for infiltration or phlebitis or redness in the area, pallor or swelling, and tenderness on palpation. So it confirms the integrity of surrounding tissues for safe administration of medication. So based on the findings, we will also have to assess the drug allergies. We will see to it that we will find it in the record, and that because the effects of the drug is so fast during the infusion, and that we will be aware of the patients at high risk for this situation. So here we have to assess the patient's symptoms before medication therapy, and we will give information to the patient, and to evaluate the effect of the medication, so that it is important also the patient would know the effect of the medication. And we will have the patient must be in comfortable position during the evaluation and assessment. For the planning, the expected outcome should be no adverse reaction during the IV infusion, and that the medication should be infused at the desired time according to to doctor's order, and that patient's intravenous site should be without swelling and inflammation or tenderness, so that the patient would also know the medication, its purpose, and side effects, and its dosage. Okay, we have to perform hand washing to minimize or avoid the bacteria or microbes during the process. Okay, next is we have to assemble the medication and supplies at bedside. So we must have the red and black ball pen, the medication tray with the micropore tape, and the cotton with cotton balls with alcohol, the IV solution and IV set, and the 3 cc syringe, and that we should be sure that everything is ready before approaching the patient. And also we have to be sure that we will make IV card to be attached to the IV after the infusion, so that it would give the nurse on duty the appropriate information regarding the patient's infusion. Next is we have to compute the appropriate flow rate, the volume per hour, or the dosage of medication given as per doctor's order. Next is we are going to compute the flow rate, the volumes per hour, the dosage of the medication. So this is the result. Next, we're going to determine the time, how long it takes for IV fluid to run for the hours that were computed. So we will just put a tape and secure it in the IV fluid bag. And then we will have to mark accordingly. So this is should be. Next is we're going to put the label on the solution, so to identify the patient and the IV fluid needed. So we're just going to attach it in the IV fluid. Okay, so it looks like this. Remove old IV fluid container from the IV pole, and then quickly remove the spike from old solution container without touching the tip, and then insert the spike into the new container of IV. So this reduces the risk of solution in drip chamber to become empty, and it maintains sterility. Hang the solution container on the IV pole and then check for air in tubing. If bubbles form, then you can remove it by ticking on the tubing. And then it gives gravity assist to deliver of fluid into drip chamber, so that checking for air in tubing reduces the risk of air embolism of the patient. Squeeze the drip chamber gently until it is half full of the IV solution. So it reduces the risk of air entering to the tubing, and if the chamber is completely filled, you cannot observe and properly regulate the drip rate. Regulate flow rate according to order. So for this one, the given 500 ml of IV fluid, and that it could be run for 8 hours. So that means there will be a 63 drops per minute. So we can regulate it by one whole full minute. For the incorporation of medication into Soluset, first make a medication card that provides a pertinent information of the name of the patient, the number, the date ordered, medication, the dosage, and time of administration. It has also the attending physicians and the signature of the nurse. Aspirate the prepared right drug with the correct dose, so it prepares the medication for administration. Here, the required water is 2 ml. That should be incorporated into the available drugs. So, if it is mixed on the penicillin with 500 milligram, the result would be 1.2 ml. That should be on the Soluset. Close the clamp of the main line. This is to determine the desired amount of IVF diluents into the Soliset. And then fill the desired IVF diluents into Soliset by opening the clamp from the bottle and then close the clamp after and check to be sure that the clamp on air vent of Soliset is open. So, IV medication is diluted with small fluid volume and that it reduces the risk for rapid infusion and it prevents additional leakage of fluid into the Soliset. Air vents allow fluid in Soliset to exit at regulated rate. So, disinfect the rubber injection port of the Soliset and incorporate the drug and then mix gently. So it prevents introduction of microorganisms during the needle insertion. By mixing gently, it mixes the medication with the solution and Soliset to ensure equal distribution of the drug. Then open the clamp of the airway at the Soliset and regulate the flow rate as ordered per manufacturer's instruction. This is for optical therapeutic effect. Medication should infuse in prescribed interval. And then place IV label on the Soliset indicating the drug incorporated and put the medication ongoing. So this alerts the nurses that medication is being infused. It also prevents other medication from being added in the Soliset. And then observe the patient for any adverse reaction so that IV medication will act rapidly. When drug is consumed, add more 20 cc of IV fluid to Soliset for flushing to ensure complete administration of the drug. This is to ensure that all medication clears the tubing. And then close the main line, then open the Soliset up to 30 ml, then close the airway. Regulate according to physician's order, OSCAR. It means open Soliset, close airway, and then regulate according to physician's order. It maintains the patent primary IV fluid. Discard all waste according to hospital's policy. This prevents accidental needle sticks and then perform hand hygiene. So it reduces the transmission of microorganisms. Finally, document all relevant information like the IV bottle number, the type of solution and flow rate, time of IVF administered, medication given, and then the client's response.